Welcome back, everybody, to another Q&A with Dr. J. Dunn and GC. Dr. J is the founder and creator of My Happy Genes, if you don't know that by now. And we are here to answer another question. Today's question is something that a lot of people will be able to relate to, I think, because high blood pressure is a very common thing in our society these days, caused by all different kinds of things. So we're going to talk about blood pressure and the genes. Dr. J, tell us what you know.
Yeah, you're right. This is a big topic because a lot of people, especially as they age, this can get to be a big problem and definitely a high risk of strokes and heart disease and et cetera. So it's a big deal to talk about. There are some genetic variants that are highly associated with increased risk of high blood pressure. And we also report on some genetic variants in the enzymes that will kind of correlate salt to high blood pressure. So we look at those as well. So I'm actually going to share my screen here and I want to show you one of my favorite ones, and one of them that, if we address it, has been the most effective at helping blood pressure, and that's nitric oxide, the nitric oxide pathway. So nitric oxide is a really interesting topic.
Yeah, I think we've done a Q&A on nitric oxide, actually.
Yeah, so I want to talk about it in the context of blood pressure. So it's, if you think of it like a hose, where the less nitric oxide you have, the more squeezing down of that hose happens, and those hoses are your blood vessels. And so when we increase nitric oxide levels, it dilates the blood vessels so that your blood pressure will drop. So it's a very direct correlation to blood pressure. And you can see we have high blood pressure down here. So, again, more nitric oxide causes blood vessels to relax and dilate, which lowers blood pressure. And a deficiency of nitric oxide can lead to tense blood vessels and cause problems in blood pressure, but also erectile dysfunction, impaired kidney filtering. So it's got some other associations as well. And so how does our body make nitric oxide and what interferes with it? One is a genetic variant in the nitric oxide synthase enzyme, this NOS enzyme here. That's what that stands for. So your inability to turn arginine, which is an amino acid, into nitric oxide because of that genetic variant can lead to a propensity for high blood pressure issues. But you'll also see this arrow pointing over here from the vitamin D receptor, because vitamin D is one of the cofactors for this enzyme. And so when we turn on this pathway, and you can see these pathways are lined up together because they turn each other like cogs in a wheel. So when you get one turning, another one will turn, and another one will turn, and then this will turn. And that's why we talk so much about the interrelationship of these particular genetic variants, because they can affect each other. But if you've got the vitamin D receptor variant where you don't absorb vitamin D, that can lead to even more problems with the nitric oxide production. And then that can lead to high blood pressure. If you want to learn more about nitric oxide itself, it's a really big topic, and it's a very interesting topic about how we make it and what all it does in the body besides dilating the blood vessels. So much more to it. Part of it is in the immune system, and part of it is in the brain. The neurons communicate with each other. So it has a lot of different effects.
Can I ask a quick question? The
Yeah,
numbers in the red circles next to the purple bubbles, what do they
yeah.
represent?
That's a good question. This chart was designed for my holistic methylation practitioners. And we discovered that because there was this interrelationship of these genetic variant pathways or biochemical pathways, that we had to address these in a particular order. So we started with number one. We found experimentally that if we didn't address mitochondrial function first, and that's where the number one is and the number two, then we created problems. And we found a very specific order that these things need to be addressed in, and that's number six. But the cool thing is My Happy Genes does it all at once. It calculates all the different genetic variants that you have, and then gives you this list of supplements that addresses all of them at once, rather than having to test through with holistic methylation using kinesiology. So down here is another area that's highly associated with high blood pressure, and that's the ACE variant, the angiotensin converting enzyme. And this enzyme, I'm going to pop this little baby open up here. Anyway, this enzyme converts angiotensin 1 to angiotensin 2. and can lead to elevated blood pressure and arterial plaquing if you have a genetic variant there. It can also increase anxiety, which I'm not really sure the mechanism of that is, other than it actually causes your cortisol to go up, which makes sense to me. And it decreases learning and memory.
Hmm.
It can also throw off essential mineral balance in your system due to decreased excretion of sodium in the urine and increased excretion of potassium. So this is where sodium can be a problem for genetic variants here. But so then angiotensin 1, if it goes up and can't be converted to angiotensin 2, then leads to some increase in high blood pressure down here and increased aldosterone. So it's got a problem there. But one of the genes also that's going to contribute to it is a genetic variant in the SULT enzyme, which is the sulfur transferase, and that causes the sulfurs to build up. And if they can't go through that enzyme, they take the side road and cause the cortisol to go up. And cortisol is our stress hormone, and that can raise the blood pressure as well. So there are contributing genetic variants along with very specific ones that can lead to high blood pressure.
And I'm
So we,
guessing that, sorry, that the ACE is where they get ACE inhibitors. There's
yes,
a classification of drugs called ACE inhibitors.
yes,
Okay.
exactly. Yeah. The other interesting thing about the ACE variant too, the ACE enzyme is a receptor for the COVID virus. The spike protein can get in through those people that had ACE genetic variants
Hmm.
were more susceptible to COVID infections.
Wow.
It was interesting. The other area that we look at is the COMT enzyme because its job is to break down adrenaline. And adrenaline is our stress hormone. And we all know that stress raises your blood pressure.
Hmm.
So if you have difficulty breaking down adrenaline and it stays in your system too long, it will lead to the high cortisol as well, but it can definitely raise your blood pressure over time. So those are the biggies.
And I would say in addition to this knowledge of which variants you might have, the diet and lifestyle report will show you foods that will support these guys working the way they should, right? There's always a lifestyle component to everything, isn't there?
Yes, absolutely. Yeah, diet and lifestyle and supplementation that can support those enzymes to work more efficiently and get your nitric oxide levels up and your ACE levels balanced, the angiotensin levels balanced, which is that's the magic. We just knowing that you have genetic variants there, it's okay. Sucks to be me, but no, there's a lot you can do about it. And we've been very successful in getting blood pressure down. That's not to say that some people don't need blood pressure medication. And it's a
Mhm.
dangerous thing to not address it and be cavalier about it. But we've also seen blood pressure drop pretty significantly where people were able to at least lower their medication or in some cases get off their medication, which is very cool.
Now, is there something correlated to people with low blood pressure?
Yeah, there are. And let me show you. That's a really good question. One of them is right here, this PNMT. This enzyme converts norepinephrine to adrenaline. And one of the signs that you have a genetic variant there is when you stand up too quickly, you get a little lightheaded or
Hmm.
dizzy. And that's generally is going to go along with low blood pressure. So I see that one most commonly. And again, we had I mentioned just briefly the salt enzymes, and they'll show up on your My Happy Genes test. So your risk slider will say, oh, not good on salt. This is on your diet and lifestyle report. So then I usually ask people, do you have low blood pressure or high blood pressure? And they're like, low blood pressure. And I'll tell them, don't worry about the salt because it's usually associated with if there's a risk of high blood pressure, then you want to watch the salt. So there's some controversy about those salt genes. So it all depends on if you have high or low blood pressure as to whether you pay attention to the salt question.
And I'm glad you brought that up because the salt recommendation is this many grams, no matter what size you are, no matter what your genetic profile is, no matter. And I find that some people get so rigorous or rigid about, I can't have any salt. They're out in a restaurant trying to enjoy their dinner, and perhaps a little isn't bad unless you really are one of those people that has to avoid salt. But it's good to bring it up that it isn't one, once again, it's not just one prescription fits everybody.
Yeah, very much. And the type of salt that you use
Hmm.
has an effect too. If you use one that has minerals in it, it's going to have much less of an effect on the blood pressure because you got the balance of the other minerals in there. Yeah. Celtic sea salt and real salt and those kind of things.
I like black lava salt
You do?
because it's crunchy. It doesn't dissolve on your food. So you
Oh,
sprinkle a little on after. It's not so much a pre-cooking. It's once it's cooked, whatever you're eating, and you put a little sprinkle on there. Very
yeah.
yummy.
I'm
Very
one of
yummy.
those people that needs salt. And
Me too.
yeah, to keep my blood pressure up because it gets so low.
Wow. That would be nice. I don't have a blood pressure problem. I'm just thinking a lot of people would say, wow, I'd rather have that problem than always worrying about my high blood pressure.
Yeah, my mother had very high blood pressure, and I look at her genes, and she's got a bunch of ACE variants and nitric oxide variants, both, which I didn't inherit. Luckily, my brother did, and he's struggling with blood pressure a little bit too because he's got her genes
Hmm.
in that category.
But I hope he's a good patient and he
He's a
takes your
great,
advice.
yes, he's the best.
All right, everybody. I think that wraps up our blood pressure discussion. If you didn't get a question answered that you have about blood pressure, just put it on the YouTube page here and we'll get it answered for you. And be sure to subscribe. If you like this, there's lots more where this came from. And if you want to be notified every time we put one out, jump on that subscription button and ring the bell and do whatever the hell they tell you to do.
Yeah, and I'd be curious if you could comment and put a comment in there that whether you have high or low blood pressure. I'd be interested to see
Mm,
how many people go for either side of that
yeah, yeah,
equation.
it is interesting. I know one person who has, it sounds like you, like really low blood pressure, and most everybody else I know is high.
Yeah,
Yeah.
interesting.
All right, people, we'll be back next week with another Q&A with Dr. J. Be well till then. Bye.
Bye, GC.